Bloodborne pathogens. Bloodborne pathogen standard. Required by OSHA 29 CFR 1910.1030. Applies to employees in all industries who may be exposed to blood or other potentially infectious materials. What are bloodborne pathogens? Microorganisms such as viruses or bacteria that are present in human blood and can cause diseases in humans. The three most common bloodborne pathogens: human immunodeficiency virus, HIV, hepatitis B virus, HBV, hepatitis C virus, HCV. Human immunodeficiency virus, HIV. The virus which causes AIDS. Devastates the body's immune system. Symptoms: flu-like illness, weakness, diarrhea, weight loss. Signs of illness may not be present for years. AIDS is chronic and fatal. Hepatitis B, HBV. Attacks the liver. Survives in dried blood for up to 1 week at room temperature. Symptoms: fatigue, nausea, vomiting, abdominal pain, anorexia. Can be chronic and fatal. Up to 100 times more infectious than the HIV virus. 884,000 people die each year from hepatitis B and related diseases. Hepatitis C, HCV. Can lead to chronic hepatitis, cirrhosis, and liver cancer. 2.4 million infected in US. Only 25% diagnosed. Can be chronic and fatal. 399,000 related deaths in 2016. Potentially infectious materials: blood, human bodily fluids such as semen, vaginal secretions, lung fluid. Any bodily fluid containing visible blood. Any bodily fluid that cannot be identified. How are they transmitted? Puncture wounds caused by sharp objects. Infectious materials contacting open wounds, cuts, or broken or damaged skin. Infectious materials contacting mucous membranes of eyes, nose, and mouth. Possible exposure incidents: during an industrial accident, while administering first aid, during post-accident cleanup, when performing routine maintenance or janitorial work. Exposure control plan: universal precautions, engineering controls, work practice controls, post-exposure follow-up. Universal precautions: treat all human blood and bodily fluids as if they were infected with HIV, HBV, HCV, and other bloodborne pathogens. Engineering controls and work practice controls. Engineering controls: hand washing facilities, biohazard waste bags, work practice controls. Personal protective equipment, PPE. First aid response, spill cleanup, laundry, waste disposal, exposure response, personal protective equipment, first line of defense, examples and uses, limitations, rules, remove before leaving work area, wash hands after removing PPE, properly dispose of contaminated PPE. Personal protective equipment. Bloodborne pathogens require caution. Use proper PPE to prevent direct contact with blood or other bodily fluids. Make sure PPE is in good condition before using. Dispose of PPE in proper containers. First aid response. Adopt universal precautions. Encourage self-care. Use PPE. Avoid applying pressure without barrier. Housekeeping. Spill cleanup. Use PPE and universal precautions. Cover spill or area with paper towel or rags. Pour disinfectant solution over towels or rags. Leave for at least 10 minutes. Place materials in appropriate container. Arrange for pickup and disposal. Housekeeping, waste disposal. Use PPE when handling. Leak-proof containers. Proper labeling. Labels. Red bags or containers. Drop-off sites. Housekeeping, contaminated laundry. Laundry soiled with blood or other potentially infectious material. Use proper personal protective equipment. Handle as little as possible. Pre-soak all contaminated clothing. If blood or other potentially infectious material gets on clothing, remove and thoroughly wash with detergent as soon as possible. Exposure incident response. Contact with skin, wash exposed area with antibacterial soap and running water. Contact with eyes or mucous membranes. Flush affected area with running water for at least 15 minutes. Contact with clothing. Remove contaminated clothing. Wash underlying skin. Report exposure to supervisor immediately. Post-exposure evaluation. Confidential medical evaluation and follow-up after exposure incident. Identify and document source and circumstances of exposure. Test source individuals' blood for HIV, HPV. Provide blood sample. Healthcare professionals' written opinion. Hepatitis B vaccination. Made available to all employees at risk for occupational exposure prior to initial job assignment. Made available after exposure incident. Summary. Bloodborne pathogens. Transmission. Potential infectious materials. Exposure incidents. Prevention. Universal precautions should be used. PPE should also be used. And proper response. This ends the presentation. There will be a 10-question quiz which follows. Question 1. The 3 most common bloodborne pathogens. A. Human immunodeficiency virus, HIV. B. Hepatitis B virus, HBV. C. Hepatitis C virus, HCV. D, all of the above. Question 2. Human immunodeficiency virus symptoms. A, flu-like illness. B, weight loss. C, hair loss. D, A and B. Question 3. Hepatitis B HBV symptoms. A is fatigue. B, nausea. C, anorexia. And D, all of the above. Question 4. Bloodborne pathogens are transmitted by puncture wounds caused by sharp objects, infectious materials, or contact with open wounds. A, true. B, false. Question 5. Universal precautions means to treat all human blood and bodily fluids as if they are not infected with HIV, HBV, HCV, and other bloodborne pathogens. A, true. B, false. Question 6. Select the correct engineering controls for bloodborne pathogen exposure. A, hard hat. B, hand washing facilities and biohazard waste bags. C, personal protective equipment. D, reading glasses. Question 7. Select the correct first aid response. A, adopt universal precautions. B, use PPE. C, encourage self-care. And D, all of the above. Question 8. Waste disposal should contain no labeling. A, true. B, false. Question 9. The proper exposure incident response for contact with the skin is washing the exposed area with antibacterial soap and running water. A, true. B, false. And the final question, number 10. The proper exposure incident response for contact with the eyes or mucous membranes is to flush affected area with running water for at least blank minutes. A, 10. B, 5. C, 15. D, 17. This concludes the quiz portion of the presentation.